I'm happy to welcome Brian Moher. Brian will be coming up and speaking to us about products liability, medical devices, and patient safety. So a little bit about Brian. Brian was called to the Ontario Bar in 2005 and has devoted his career to complex litigation. He has acted as trial and appellate counsel with experience at Superior Court of Justice, Divisional Court, Court of Appeal, and the Supreme Court of Canada, as well as being appointed you got to help me with this one. Thank you very much. Counsel in the United States. Brian spent the first decade of his career as a health law defense lawyer in both civil and professional regulatory proceedings. In 2015, Brian started working as a plaintiff's counsel in medical negligence actions, and we're happy for it. Brian has practiced as a plaintiff class actions counsel since 2005, and he acted as trial counsel in medical device class actions, including St. Jude Medical v. Anderson and Taylor v. Canada. Welcome, Brian.
I was going to say, I hope it wasn't something I said resulted in everyone leaving, but I hadn't said anything at that point.
It might be the post-lunch bio break.
Well, okay. Got this going. So in the summer of 2018, I was sitting in a really hot house in Ottawa, waiting to meet with a former lead scientist from Health Canada, preparation for a class action trial. And it was very, very late. It turned out to be about 3 hours late that day. So I was waiting and waiting, and there was somebody else sitting in the room, somebody I'd never seen before. He was waiting. We both looked sort of disgruntled and dissatisfied. And after about half an hour, we decided to start chatting, try to find common ground. But that conversation ultimately led to me discussing with this man his theories about product medical device regulations and how to create a universal framework for emerging nations, for existing nations, in order to optimize safe patient outcomes. And I was absolutely enthralled and fascinated. He was enthralled and fascinated, and we just got talking and that ultimately led to us collaborating. That was Michael Chang from the World Health Organization. It led to me, Michael, and Leo Letnyami, Dr. Ed Nacky, who was the founder of Adverse Events Vigilance in Canada. We wrote a number of papers, textbook chapters, all running with this idea. And this is a framework for assessing medical device liability, understanding where the lines are drawn. When a person's injured by a medical device, whether by operation or design flaws, there are a number of possible wrongdoers. And if you work in this area, it's something you don't want to do. It's a shotgun approach. But that could include the manufacturer, the distributor, the purchaser of the device, the healthcare professionals and facilities that use, manage, and maintain the medical device. It can even include the regulatory body that gave the device regulatory approval. So there's a wise saying that applies in these kinds of cases, and that's, if you are looking for a fight, you go into a bar, don't pick a fight with everyone in the bar. Have a plan. So this is what this is about. In other words, is there an easily adaptable principled framework with universal application that can be used for assessing the lines of liability in cases concerning medical device litigation? So we start with the proposition that product safety does not equate to patient safety. And it's a heuristic bias to think, okay, if the product's safe, it's safe in the patient. And that's not the case. Product safety is a function of whether the medical device meets the relevant regulatory requirements for safety and efficacy. Even if a medical device meets those relevant requirements, it does not automatically translate into patient safety. Patient safety may be compromised by the improper use or maintenance of the medical device. For instance, a medical device may be fit for use in certain environmental conditions, but not others. So to simplify things, let's say we consider the domain of product safety to be one of regulatory status. And for the domain of patient safety, we look at two additional factors, two additional steps. The context in which the medical device is to be used, and what is involved in the safe maintenance and management of the medical device. So first essential step, step one, a product safety assessment. And the focus of the assessment is by the regulator on the general safety of the product. Is there adequate evidence of safety and efficacy? So when you're looking at this kind of case, you're looking at a case where something went wrong with a medical device. One of the first questions you ask is in the area of regulatory requirements. Does the device comply with the relevant regulatory requirements? And is it authorized to be on the market by the local regulator? And that, as I indicated earlier, is the domain primarily of product safety rather than patient safety. And this will become a little clearer as we go along. But in the domain of patient safety, we proceed to step two. And step two is a use context assessment. In other words, you want to assess the medical device. Maybe the medical device has met all the requisite criteria to be considered safe and effective, and receive regulatory approval and clearance, but there are additional factors that impact on the safe use of that device. These include environmental and human factors. So for example, with an environmental factor, humidity or lighting may be something that will affect the safe operation of a medical device. And if you're looking at one of these cases forensically, you want to also keep this in mind and consider it. There are also human factors in terms of the safe use of a device in context. So what kind of training is required? Is the person who's going to be using the device the same person who's receiving the benefit of the device, the patient, or is it somebody at a facility who's using the device? What instructions were given to that person? Are those instructions adequate? Have the potential risks and the pros and cons been considered? Have they been communicated? And at step three, in the domain of where the focus is on patient safety, we also have safe use and management of the device. And this means throughout the life cycle of the device, can the device be safely used? Has it been properly maintained? And is there adverse events vigilance? And is there a robust reporting regime involved? Or I can put this in very simple terms. First, does the product comply with local regulations? Two, which would be step two, is the product safe and reliable in my environment? And does it meet my various specific situational expectations? And third, how can I ensure the preservation of the device quality, safe and effective use, and monitor its performance and report adverse events? So to go a bit more in depth on step one, the user wants to ensure that the marketed product has received appropriate regulatory clearance from the authority of the relevant country. I'll come to a case example to illustrate all of these momentarily, but essentially the very, very simple focus here is, was the device appropriately approved by the regulator? And you've got two stakeholders at least here at this phase, the manufacturer and of course the regulatory body. At step two, this is the contextual assessment of medical device. It's important to note that step one doesn't cover the environmental and human factors that may affect a particular user of a medical device. So the user must proceed to consider the specifications of the marketed device and examine the range of environmental and human factors under which the device was designed to be used. And these factors include the quality, condition, and suitability of the physical environments in which the devices will be used. Following this assessment, you then look at whether the marketed product is still safe given the user's environment and human factor conditions. In this case, no. And step three, safe use and management. So manufacturers are required to provide a number of things in the context of providing medical devices to the community. They are required to provide instructions for safe use, to preserve and maintain the quality of the device in the delivery process to the customer, and to conduct post-market surveillance, adverse event reporting, corrective action, and preventative action. After delivery, however, the device is possessed by the user, and it's the user of the device, and that may include the patient who's using the device, whose responsibility is to follow the safe instructions, maintain device quality, and monitor device performance. In case of medical device implants, this is also accounted for in the universal framework that I've just displayed. Step two is a critical step in which the physician or surgeon must be educated on what the potential risks are associated with a particular device, what the qualifications and trainings are required, and what facility and human support resources are needed to perform the surgical implantation. Considerations in step two concerning implantation can go far deeper in that information disclosure is the subject of great debate, involves numerous stakeholders, the manufacturer, the vendor, purchasing facility, intermediate users, and so on. But at step three, the user must be educated about the device in order to take proper care of it and to remain vigilant in detecting and reporting any deviation from proper functioning or the occurrence of adverse events. With respect to healthcare facilities, key considerations include safe use, which is that each medical device is unique and there should be a policy in healthcare facilities that each user must be trained before using any medical device. Quality preservation is another consideration, maintaining a medical device's quality and integrity. And these are all factors that you want to look at also forensically in assessing where the lines of liability fall. Medical device storage. Where is the medical device being stored? Is it an appropriate environment for that medical device? Adverse event vigilance. This is the performance of surveillance and adverse event reporting. Healthcare facilities will also want to know about medical device problem investigation, programs for investigating possible adverse outcomes, and corrective action. And you'll find these often in the bylaws. Procedures for notification. This is the dissemination of device alerts to stakeholders. And disposal and replacement. At the end of the medical device's life cycle, you want to dispose of it safely and appropriately. And in the case of Endine et al. Versus St. Joseph's General Hospital, this was a 2017 trial decision. I acted as appellate counsel. I wasn't involved in the trial, but I have some familiarity with the case. The plaintiffs each had surgery at the defendant hospital where they each received an implant in their temporomandibular joints, which later caused them catastrophic injuries. The hospital acquired the devices at issue after the 1983 amendments to the medical device regulations. And the 1983 amendments to those regulations required that a medical device received what was called a notice of compliance, signifying that appropriate evidence of safety and efficacy had been received by the regulator and that the regulator had turned and reviewed that evidence and provided a level of assurance that the device had met the requirements to be considered a safe product. Remember, product safety and patient safety are two different things. The plaintiffs commenced actions against the hospital and the oral surgeons that performed the surgery. Well, hospital and oral surgeons cross-claimed against each other in the actions. The trial on liabilities bifurcated, and there were four test cases. The trial was bifurcated first to deal with the issue of liability. And the trial judge found that the hospital was negligent in acquiring the implants, and the oral surgeons were negligent in failing to take due care when assessing the viability of the implants. Fault was apportioned as follows: 5% to the hospital, 20% to the oral surgeons, 50% to the bankrupt manufacturer, and 25% to the bankrupt distributor. Neither the manufacturer nor the distributor were parties to the actions. The trial judge nevertheless saw that it would be appropriate to put blame where blame should be put. Ultimately, the trial judge granted judgment against the hospital for 5% of the damages that were to be assessed in the second phase of the trial. On appeal, the awards against the bankrupt manufacturer and distributor were set aside. They were not parties to the action. And even if they were not parties to the action, so this was obviously a short putt. The hospital's degree of fault was increased to 20%, and the oral surgeon's degree of fault was increased to 80%. Now, why do I find this decision of interest for this particular framework? Well, recall step one, we talk about regulatory approval. We must ensure that the product has received regulatory approval. If you've got a case, may sound like a very simple thing, it's on the market, check for whether the device received regulatory approval. Check whether the device, the regulatory approval was granted with all the statutory conditions fulfilled. The 1983 amendments to the medical device regulations required that a medical device receive a notice of compliance. At trial, the hospital was found to be at fault for failing to check whether the device had received regulatory approval. In the trial judge's mind, the notice of compliance meant that sufficient evidence of safety and efficacy had been presented to the regulator, which is Health Canada. The hospital had failed to make appropriate inquiries and was found at fault for having failed to do so. If step one of this framework had been adopted, then the device would not have been purchased by the hospital, and it would not have been implanted in view of its lack of regulatory approval. Using this framework as a retrospective forensic tool to say results, it does not have been an acquisition of the device. At step two, the user must ensure that the device is appropriate for use within a given context. The surgeons who implanted the medical devices were found to be at fault at trial, and the trial judge stated, it was quite a lengthy decision, but the trial judge stated in pith and substance, the plaintiff suffered damages when the oral surgeons decided to go ahead with the implant surgery despite warning signs available that a Teflon implant would fail in a patient for 3 days. It's critical in context. And if we consider step three, which is safe use, management, and adverse event vigilance, this device was subject to worldwide recalls in 1990. The patients in the lawsuit did not learn about the recalls until 1994 at the earliest. Their injuries could have been reduced if they had been advised earlier of the manufacturer's bankruptcy in the face of litigation over the defective device. Given the passage of time, their injuries progressively worsened. Had the hospital instituted adverse events vigilance, including post-market surveillance, this would likely have reduced the plaintiff's injuries and the hospital's resulting exposure.